It's a chilly January day in 1969 when a young woman enters a hospital in Boston. She'd come in for what should be a routine surgery, a tonsillectomy. But within hours of being admitted, her temperature spikes, her blood pressure drops, and she goes into septic shock. The doctors operate and find that her tonsils are filled with a rare bacteria called Streptococcus pneumonia. They give her a heavy dose of antibiotics, and thankfully, she survives. But this case wasn't like the others. This patient was also pregnant. And as she fights for her life, so too will her unborn child. Now, this is a dramatic example, but bacterial infections can spread quickly and cause serious illness. So let's learn how to protect ourselves and others from harmful bacteria. Many bacteria are harmless or even beneficial, like the bacteria that live in our guts and help us digest food. But some can make us sick, and when they do, it's important to act fast. That's because bacteria can multiply quickly. A single bacterium can become 2, 4, 8, 16, 32, and in just a few hours, millions. And if left untreated, some bacterial infections can be deadly. So to keep ourselves and others safe, there are 3 things we can do. First, wash our hands thoroughly with soap and water for at least 20 seconds, especially after using the restroom and before eating. If soap and water aren't available, use an alcohol-based hand sanitizer with at least 60% alcohol. Second, cook food thoroughly. That means cooking meat, poultry, and fish to the right temperature to kill any bacteria that might be harmful. Third, take antibiotics only when prescribed by a doctor and finish the full course of antibiotics even if we start feeling better before they're finished. Taking antibiotics can prevent the infections from getting worse and help prevent antibiotic resistance, which happens when bacteria evolve and become less responsive to antibiotics. If someone we know has a bacterial infection, we can also help by being considerate. That means covering our mouth and nose when we cough or sneeze, staying home if we're sick, and keeping our distance if someone is contagious. By doing these things, we can all help prevent the spread of bacterial infections and keep our communities safer. Now you know what to do to stay safe from bacterial infections. Stay tuned to learn more about the amazing microscopic world around us.